Have you ever gotten a medical scan for something like chronic back pain and then stared at the report just feeling completely lost? Well, in this explainer, we're going to dig into that often confusing and honestly pretty stressful relationship between what a scan shows and what you're actually feeling.
Right? This is the question. The one that's just buzzing in the back of your head the second your doctor orders the scan. You're searching for a clear answer, a concrete reason for your pain. But what if the answer on that report isn't really the answer at all?
You know the drill. For so many of us, the journey starts right here. You've got persistent back pain, so you get sent for an MRI. It feels like the high-tech, definitive way to see what's wrong, to find the problem. The machine makes all its noises, and then you get a report filled with really intimidating technical words.
And that language can be, well, terrifying. You see words like degeneration, herniation, stenosis, compression. I mean, these sound serious. They sound broken. They sound exactly like the reason you're in so much pain. And of course we do. It's totally natural. We think of the MRI as the gold standard, right? We want it to just point to the one broken part, the single source of the problem that we can then go and fix. It feels logical. It feels like how medicine should work. But here is where the story takes a really crucial and honestly pretty surprising turn. Because medical research has uncovered this deep paradox that totally challenges that whole way of thinking. Turns out the connection between what's on that scan and what a person actually feels, it's nowhere near as simple as we think. So let me just ask you this. What if a lot of these scary-sounding findings, the ones that cause so much stress, are, well, what if they're just normal age-related changes? Kind of like getting wrinkles on the inside, rather than a sign that something is terribly wrong. Okay, now you have to hear this incredible statistic from a major study. Over 90% of adults over 60 who have zero back pain at all show signs of disc degeneration or bulging on their MRI. Just let that sink in for a second. The vast majority of people walking around totally pain-free have what you'd call a bad MRI. And look at this table. It's wild. Just look how incredibly similar the numbers are for people with and without back pain. You've got 60% of people with pain showing disc degeneration, but so do almost 54% of people without pain. And high-intensity zones, it's pretty much identical. These abnormalities are literally everywhere, whether you're in pain or not. This whole thing actually has a name. It's called the clinical gap. It's the official term for this massive disconnect between the picture on the screen and a person's actual real-life experience. The image itself is just not the whole story, not even close. Now, this isn't just some quirky little medical fact. This clinical gap has serious, real-world consequences when we get it wrong. And we get it wrong when we shift the focus from treating the actual person sitting in the room to trying to fix the picture from the scanner. The research is pretty clear on this. When we jump to an MRI too early without a good reason, it can set off this whole cascade of negative outcomes. We're talking higher healthcare costs, a 3 times higher rate of surgery, more and more specialist visits. And for what? For all that extra time, money, and intervention, there's no improvement in the patient's ability to function and no real difference in their pain. I mean, this quote from the research just says it all. Chasing the image can lead straight to unnecessary procedures. And, this is also where patients can start to feel completely unheard, maybe even gaslit. Your pain is 100% real, but the treatment gets obsessed with an image that might not even be relevant, and that leads you down a path that doesn't actually help you feel better. So, if treating the scan isn't the answer, then what is? Well, the evidence is pointing us toward a much better, more effective approach, one that puts the power right back where it belongs with you, the patient. It's called patient-centered care, and the idea is actually really simple, but it's also revolutionary. Instead of being laser-focused on fixing some structural thing we saw on a scan, the main goal becomes improving your quality of life and helping you get back to doing the things you want to do. This chart lays out the shift in thinking perfectly. The old way, treating the scan, is all driven by that MRI report, and the goal is to fix the image. The new, better way, treating the person, is driven by your goals. The focus is on your actual day-to-day ability to live your life. It's a total game changer. And a fantastic practical tool for this is setting SMART goals. This framework helps you define what success actually looks like for you.
It's not about having a perfect-looking spine on an MRI. It's about being able to walk your dog for 30 minutes, or getting back to gardening, or playing with your grandkids without pain. It makes your recovery personal, measurable, and totally actionable.
So, where does this leave us? What does it all mean? It means we really have to change how we think about these powerful imaging tools. They're an important piece of the puzzle, for sure, but they're just that, one piece. They are not the whole puzzle. An MRI is a static snapshot. It's one single frame from your movie. But your pain, your function, your life, that's the whole dynamic, evolving story. Your lived experience matters so much more than any one picture. That is the key thing to remember. And that leaves us with one last big question to think about. Maybe the problem isn't the MRI itself, but what we're asking it to do. Instead of just asking what's broken here, maybe the better question is, how can this picture, combined with this person's story and goals, help us map out a path back to a better life?